Cindy Lord. I'm the PA who's going to do your exam today. How are you today, Mike?
Very well.
Okay, good. I'm just going to quickly wash my hands. Throughout the exam, while I'm doing your physical, I'm going to be assessing Mike's overall state of health, his dress, grooming, and hygiene, his mood, his manner, overall state of awareness. He seems alert. The world needs more alerts. And his facial expressions, and he doesn't seem to be grimacing or doing anything kind of funky. Mike, you know, I'm going to start with a series of questions. They may seem a little silly for you, but bear with me. They're just part of the exam. Could you state your full name for me?
Michael Joseph Bouchard.
Okay. Mike, can you tell me where we are today?
Camden, Connecticut, Quinnipiac.
Yeah. And
North Haven.
North Haven. Yeah. Can you tell me what today's date is?
November 12th.
Okay. What year are we in?
2011.
Okay, good. Yeah, that Mother's Day really took its toll.
What is today's date?
17.
That's okay. Yeah, Moini brought me a really good one today. Okay, and can you tell me about what time of the day it is?
Morning time.
Okay, all right. Mike, I'm going to give you 3 words. I'm going to ask you to repeat them, and then I'm going to ask you to remember them for me. I'll probably forget them, but I'm going to ask you to remember. I'm going to ask you to recall at some point during the exam a couple times those words. The words are cow, bell, lamp. Can you repeat that for me?
Cow, bell, lamp.
Great. Can you repeat after me? No ifs, ands, or buts?
No ifs, ands, or buts.
Mike, can you tell me something that's going on? You know, some current events. What's going on in our country? Any hot news?
Economy. Hot
Okay.
news, yeah.
Anything in the world? What's going on in the world?
Lots of wars.
Lots of wars. And can you name the last 3 presidents for me of the United States?
We have, who's the current president right now? We have,
Okay, good.
yeah. I'm a little nervous too, okay, guys?
He's a good actor. If you were walking down the street, Mike, you saw an envelope, address, stamp, everything on it, what would you do with it?
Mail it.
Good. I'd look for money first, but that's okay. And if I said to you, people who live in glass houses shouldn't throw stones, what do you think that means?
Don't hurt people.
Okay. And what were those 3 words I asked you to remember?
Cow, bell,
All right. And Mike, I'm going to ask you to spell the word world for me.
W-O-R-L-D.
I want you to spell it backwards.
D-L-R-O-W.
Okay. You could do serial 7s here, start from 50, go back by 7. All right, I'm going to start next with vital signs. I'm going to start with your temperature. I'm going to put this under your tongue, just kind of hold it there. And we do expect you to wait 98.5. It doesn't take long. Okay, that's good. Now we're going to move on and do your blood pressure. While I assess your blood pressure, I'm going to first assess those brachial arteries. Feel them. Symmetrical, smooth, okay, even. Make sure I move up the gown. I don't want to put the blood pressure cuff on top of the gown. I'm going to use my hip. That's why I have big fat hips, so I have a place for you to rest your arm on. Okay, cuff. Assess your blood pressure. .138 over 80. I'm going to assess that blood pressure on the other side. Again, be sure that I've moved up the cuff, rest his arm so it's not hanging in no man's land.
Okay, blood pressure on that side is noted. You can move on.
Thank you. Okay, next I'm going to go and I'm going to assess his radial pulses. Palpating both radial pulses. They're symmetrical, they're not bounding, they're smooth and even. Now I'm going to count his heart rate for 1 minute.
Radial pulse 1 minute noted. You can move on.
Okay. Next, I'm going to assess respirations, noting that he's breathing smooth, evenly. There's no tachypnea. I don't see any accessory muscle use. So I'm just going to count his respirations for a minute.
Respirations 1 minute noted. Move on.
Okay. Next, I'm going to go on and I'm going to go to the skin. And I'm going to start by looking at the color of his skin. And it's tanned. It's more tanned in the sun-exposed areas a little lighter in the non-exposed areas. I'm going to look at vascularity, looking for any cherry angiomas, spider angiomas. I'm going to take this away, Mike, if you don't mind. I don't see any lower leg varicosities. Looking for moisture. His skin is not moist, it's pretty dry. Okay. Texture, it's smooth throughout. A bit of roughness on his hands and his feet, but that's to be expected. And so texture, temperature is warm, a little cooler, slightly cooler in the distal extremities. Temperature, texture, thickness. It's appropriate. I don't feel any excess thickening, no excess thinning of his skin. Nice bruises there, some right abrasions. Texture, temperature, thickness, turgor and mobility. Checking his turgor's resilient. Okay, and the presence of any lesions. So a little bit of scrapes there from his big obstacle course this weekend. So we did color, moisture, vascularity, temperature, texture, thickness, turgor and mobility, the presence of any lesions. And I don't see any. Okay, I'm going to move on to the nails. I'm going to look at the nails, cap refill, less than 3 seconds. The nail plates are firmly adherent to the nail bed. The free edges are smooth and not ragged. Palpating the lateral folds for any tenderness, which not elicited. There's no redness, no tenderness, no swelling. I'll do the toes while I'm here. Again, cap refill, a little bit of bruising on his toenails, but you know what? When you do these things, you get kind of beat up. Palpating the lateral nail folds. Looking at the interdigital spaces, no fissuring. Okay, good. All right, I'm going to move on. Hey, what were those 3 things?
Cow,
Yeah.
bell, and lamp.
Good. I'm going to start with his head. His head is normal cephalic, atraumatic. It's midline, held erect, and symmetrical. Face is oval-shaped with symmetrical facial features, no abnormal facies. I'm sticking out his face. That's good. I'm going to palpate the scalp, which appears to be freely movable, and the skull. No depressions, nodularity, tenderness on the palpation. His hair is short, it's thin, it's brown, it's smooth, a little bit receding, male distribution pattern, so that's fine. I'm going to move on now to the face. I'm going to palpate over the temporal arteries. I'm going to ask you to clench down for the temporalis muscle and relax, and I'm going to ask you to clench and relax for the masseter. Open and close your mouth. Assess those TMJs one more time. Nice, not too poppy. That's good. All right, so I'm going to start with the eyes. I'm going to look at the positioning of the eyes. They're symmetrical. They're well aligned. There's no exophthalmos or lid lag. Looking at the eyebrows, they're full. I'm going to palpate over the eyebrows, getting the lacrimal glands there, and the nasal. We'll get the lacrimal apparatus here. Just close your eyes. I'm going to palpate over the globes. They're non-tender. I'm looking at the eyelashes, and let's get my mic because it's a little easier to do. I'm going to look at the eyelashes. They're pointing outward. I don't see any crusting. The eyelids, no entropion or ectropion. There's no styes or chalazion. I'm going to ask you to look up. Okay. Palpable conjunctiva is non-injected. Bulbar conjunctiva is clear, and it's a mild injection, actually, mild. The sclera is white, okay? His pupils are equal and round. His irises are hazel with well-defined limbus. Look at his cornea and his lens, just look straight ahead, and they're clear, no corneal clouding. Okay, good. I have my light here. I just want you to look straight ahead at me, Mike. Bring the light around. Direct response, consensual, direct, and consensual, okay? And if you just kind of close your eyes and open your eyelids, okay? And then blink a few times, good. Just watching movement of the eyelids and eyebrows. Okay, good. Eyebrows, eyelids, eyelashes, pupils, cornea. Okay. moving on. You don't wear glasses, right? Okay, so we're going to have you cover your right eye with your right hand. And I want you to hold this right about here, 14 inches. I want you to read the smallest line of numbers that you can from left to right.
428739.
Okay, if you could switch for me, cover the other eye. Okay, just blink a couple seconds. Okay, and read the smallest line of numbers that you can, but from right to left.
937824.
Okay, you can unblock and kind of blink a few times so you can get, there you go. And if you'll read the smallest line again, left to right.
428739.
Okay, great. Okay, so next, my extraocular muscles. I want you to look straight ahead at me, Mike, and I want you to follow my finger with your eyes. Don't go moving your head around, just use your eyes. Look over, up, down, back, over, up, down, back, over. I just want to see how smooth his gaze is. Okay, good. Now, Mike, look at my finger out here, and now just follow it in. Okay, good. So accommodation and the near reflex. Next, we're going to do confrontation testing. So I'm about 3 feet away. Mike, I want you to cover your right eye with your right hand. I'm going to cover this one. I want you to tell me when you see my finger wiggling. I want you to look straight ahead at me. Don't go looking with your head. Don't have your eye looking out. Just here. When you see my wiggling finger come into your field of vision, just say, see it. Okay? All right.
See it. See it. See it. See it. See it. See it. See it.
Look straight ahead at me. Don't cheat.
See it.
There you go.
See it. See it. See it.
Okay? We're going to switch. So cover that eye. We're going to do the same thing. Just look straight ahead at me and wait till you see that finger wiggling. Don't go moving your eye around. Okay? This, I suppose. Ophthalmic, move on to the fundoscopic exam. It's all set. I would dim the lights. I'm going to look in Mike's right eye, so I'm going to use my right hand and my right eye. Mike, what I'd like you to do is just, I want you to look right here. Focus on my ear. Okay, good. And there we go. Optic disc is a cream colored, borders are well defined. Vessels radiating both arteries and veins coming from the center with no pathologies. Okay, move over here. So left eye, left hand. Again, the lights are dim. Just aim right through my ear. Just aim. Perfect. Okay, there we go. And the same, good. Optic disc is visualized as well as the vessels. Okay, Mike, just look ahead straight at me.
Noted.
Whoa, okay.
Nothing.
That was a
You
little
got
too
me.
quick. Okay, look ahead straight at me. Okay, good. All right, I'm going to move on to Mike's ears. Looking at, again, the positioning, they're well aligned at the appropriate level. There's no cauliflower ear, good recoil. Any tenderness when I pull on the tragal tug? Any tenderness here or here?
No.
Mastoid? Okay. Post-auricular area, no scaling or crusty psoriasis. I don't see any, things like carcinoma or Darwin's tubercle or any pits or anything like that. All right. Good. All right, Mike, I'm going to do some hearing tests now. So I'm going to come behind you. I'm going to block one ear, and then I'm going to whisper sweet nothing in your other ear, and just tell me what I say. Okay?
My hearing's not too good.
Okay.
Yukon. Huskies. You guys probably hear better.
Or the president. Bobcats or something. All right. Weather? Mike, can you hear that?
Yes.
Do you hear it equally in both ears, or do you hear it better in one ear over the other?
Better in my right.
Okay. So the louder rises to the right. All right, moving on. Mike, I'm putting this on the mastoid. Do you hear that?
Yes.
Tell me when it stops.
Stop.
You still hear it?
No. Yes.
Okay, tell me when it stops.
Stops.
Good. Mastoid, can you hear it?
Yes.
Tell me when it stops.
Stops.
Alright, tell me where to stop. Alright. Come over here and look at his ear. So his right ear. Took a little bit. I've got my right hand. And the external auditory canal is clear, it's free of cerumen, it's pink mucosa, fine little hairs. Tympanic membrane has good light reflex, it's a grayish color, there's no perforation, no redness. Come over here, got his left ear, got my left hand. Protective maneuver. Again, the external canal, auditory canal is a teeny little bit of cerumen, but nothing blocking it. He does have some scarring on that left TM, on the the posterolateral aspect, but otherwise bony light, good light reflex, and no perforation. Okay, so I'm going to move on to the nose, looking at the nose to see that it's symmetrical. It's well placed on the face. There's no bony or obvious deformities of the nose. I don't see any lesions of the nose. Any tenderness when I palpate there? Good. Just sniff for me. Good. Sniff for me. Good. Mike, we're going to do that again, but this time I'm going to ask you to close your eyes, and I'm going to place a scent underneath your nose, and I want you to identify that for me. Sniff.
Cinnamon.
Okay, great. To the other side. Yeah.
Coffee.
What brand would that be?
I don't know. That's my favorite.
Okay, good. All right. Move on. Now, look in the nose, but I want to again use protection, so I'm stabilizing the nose, my hand here. Look in the nares, doesn't matter what hand you use. Looking at the septum, it's midline. This I can see his inferior turbinates, nice and pink and moist. There's no mucus. The other side, the same thing. No polyps. Turbinates are pink, no mucus. Mike, what were those three things again?
Cowbell lamp.
Good. All right, so I'm going to move on to the mouth. I'm going to start by looking at the lips. Well-defined vermilion border, no cheilitis, no chapping, a little bit dry, but no chafing or chapping. I'm going to look inside, open up for me. I'm going to look at the buccal mucosa. It's pink, it's glistening. I see Stenson's ducts, and they're patent. The gingiva appears to be well adherent to the teeth, no hypertrophy or gingivitis. Teeth all appear there. I don't have time to count them today, but tapping doesn't seem to elicit any tenderness from him. The hard palate is well rugated, no bony exostosis there. Soft palate is pink, no vesicles. Can you lift your tongue up for me? Floor of the mouth, there's Wharton's ducts, and they're patent. No varicosities, again, no bony exostosis. Can you just stick your tongue out gently and say ah? Speak ah. Good. See the rise of the uvula is midline. His tonsils are 1+. You put your tongue in and just keep your mouth open wide. Good. Posterior oropharynx, a little bit of postnasal drip, no cobblestoning. Stick your tongue out. Okay. It's midline. It's no fasciculations. There's no lateral deviation. It's symmetrical. It's well papillated. Palpation of the mouth. Okay. Mike, can you stick your tongue out for me? Palpate the lateral aspects, the dorsum and the ventral aspect of the tongue for induration or lesions. None there. Okay. And I'm just going to palpate, just relax your mouth close a little. Yep. Palpate the buccal mucosa coming around, so no mucoceles. Okay, turn my finger here along the gingiva. I don't need a light to do this. Hard palate, palpating that. And we're going to do the floor of the mouth. Good. All right. And we don't do the soft palate, obviously. And Mike, I just want you to kind of open up and gag reflex. Okay. got you there, huh? She's got your back. All right, Mike, more silly little test. I want you to close your eyes as tight as you can and don't let me open them. Open them up big, big, big. Yeah, good. And show me some crinkles on your forehead. Good. Smile. Show me all your teeth. Puff your cheeks out. Unpuff. Move your tongue cheek to cheek inside. Stick your tongue out. Again, midline, symmetrical, no fasciculations. Okay, purse your lips. Frown. Turn your head into my hand. Turn your head into my hand. Shrug your shoulders up and don't let me push you back. Okay, good. We're going to move on. I'm going to look at the neck. Seeing that it's symmetrical, I don't see any obvious masses. I don't see any obvious pulsations, artery or vein. And I don't see like any torticollis or anything like that.